Hello everyone, my name is Anastasia Herman, and today we are taking you to show you one of the pioneer very first clinics in Lviv, Medicover Ukraine. With its outstanding facilities, cutting-edge technologies, and high-skilled professionals, embryologists and doctors, we will take you behind the scene and show you what really makes Medicover so exceptional. So, Medicover in Ukraine, history, mission, values. Dr. Lydia, it's my pleasure to have you today. And I have a couple questions regarding the Medicover in Lviv. So, could you share with us what is the history behind establishing Medicover in Ukraine?
First of all, Anastasia, welcome you.
Thank you.
I would like to welcome you here in Medicover Lviv. I would like to tell you several words about Medicover. Medicover started working in Ukraine in 2014, started in Lviv. Now we have 5 clinics in Ukraine, one of them situated in Lviv, another in Dnipro and in Uzhhorod. These 3 clinics are specialized in fertility treatment. Regarding fertility treatment, I mentioned 14 years. But if we will look back in the history of Medicover, in 14 years, one of the first clinic in the Western Ukraine who started working with fertility patients joined the Medicover group. And nowadays we have the history of fertility treatment in the Medicover more than 20 years. This first clinic was founded in 2001. And since then, we have several doctors and embryologists in our team with more than 20 years of experience.
That absolutely makes you unique. What you can share with us about the Medicover as a group itself?
As you know, Medicover is a part of the big network of Medicover clinics situated mostly in Europe. We have different branches in Medicover, Medicover Fertility, Medicover connected with general practice, with surgery. And in Ukraine, especially in Lviv, we have several branches of Medicover. And something unique in Lviv is that we have actually fertility as the main treatment we perform here for our patients. Started with fertility only. With years, we were growing and we added different specialties to Medicover. And now patients, starting from the entrance of the clinic, can do all medical services, can have all medical services here in one clinic. And for sure, it will help us in the future treatment, future preparation and follow-up of pregnancy with this patient. One of the advantages of Medicover is its location. So Medicover clinics are located not far from the Ukrainian border. Lviv is approximately 60 kilometers from Polish border, and Uzhhorod clinic is even much more closer to Hungarian border. From patient coming abroad, it may be very convenient to come to Ukraine, not going through all the country, but stay near the western borders of Ukraine. From our side, we arrange the transportation, we arrange the trip for our patients. We stay in touch with them when they are planning their trip, when they are coming here, and we can arrange the transportation from the nearest airport to the clinic they will choose for their further treatment.
What is the mission and the core set values of the Medicover in Ukraine?
The main mission of Medicover to help every patient who comes to Medicover with their questions about fertility. As a clinic with a history and more than 20 years of experience in the infertility treatment, in the field of infertility, we are trying to help every patient who comes here. We know that every patient is unique. Every patient has his own history of fertility treatment, of fertility unfortunately unsuccessful attempts. We are trying to do all the best, starting from conservative treatment for the patients who came for the first time with some problems to have the pregnancy, to reach the pregnancy. But unfortunately, not always it is possible. So we are specialized in different fields of IVF treatment. We can provide any kind of fertility treatment available nowadays worldwide.
That's great. And what is the Medicover's approach for patient treatment you can highlight?
So we can provide different kind of treatment. We are working with oocytes, we are working with donor oocytes, we are working with donor sperm. And actually one of the peculiarities and one of the advantages of Medicover is our database of donor eggs, of donor cycles of treatment. As a part of Medicover, we have also our own egg bank. And egg bank is something special which we have inside of our clinic, and in our database we have more than 300 donors available for taking part in the program right now. Also we have egg bank, and there is more than 7,000 eggs available also for choosing. So one of the advantages in treatment when we need egg donation program, we do not need to wait actually. We can work with so-called fresh oocytes when donor is stimulated and with donor is preparing for the taking part in the egg donation program in the same time with the patient without freezing the eggs. But sometimes we have some time to wait to synchronize the cycles and so on, so it may be a bit complicated. But if we will talk about our eggs, about our donor eggs, our donor bank, so there is no time to wait as far as we have a lot of donors. One of the peculiarities, actually it's not a peculiarity, but maybe it's something unique, or I hope in the future it will be the something like must-have. We perform genetic testing for our donor. Actually, it is advanced genetic testing. As a part of Medicover, we work with Medicover Genetic Laboratory, which is situated in Cyprus, and we test our donors for more than for being carrier, to exclude actually them to being carriers of genetic diseases. So we test routinely, we test our donors for 500 genes, actually 505 genes. It's the latest package of testing, and we are excluding such diseases which can be dangerous for our patients, like, for example, X-linked disease, CMA, and some other dangerous diseases which can be inherited by children on the couple. One of the advantages our patients have is that they can also be checked for being carriers of these diseases. I will just give you an example. For example, donor, I didn't mention that all our donors are mothers. So due to our rules, all donors, all egg donors who are included in the program, they have at least one healthy child. So, and also, for sure, it must have for our donors to have proven fertility. And all our donors are tested for these genes just to exclude, maybe they are carriers of some X-linked diseases, and we know that in this case the baby boy can be affected with the disease. So we exclude such donors, so there's no possibility to have such disease. But also we have different genetic diseases which so-called autosomal recessive type of inheritance, and donor a woman can be fully healthy, but she may be the carrier. And in this case, we can perform a matching. This is a procedure when we test a potential father for being carrier of some specific disease, maybe which the donor is carrier of, or couple knows that the man is carrier of these diseases. Actually, it's not only about egg donors, it's about couples. So if couples are carriers of some genetic disorders, so we can perform the screening to exclude the possibility of them to have affected child. After both biological parents are tested, so we can perform matching to understand if there is a risk of for this couple to have affected child, or there is no risk. So, and I suppose that when you are choosing egg donor, so it's something which has to be done for sure.
Yeah, that's absolutely unique. That's something our patients really like about Medicover.
And actually, you asked previously about also our peculiarities. I started with choosing of egg donor, but not all couples for sure need egg donation. Yes, but we have couples who tried different kinds of treatment, and they have to choose and make decision to have another kind of treatment. So we are also providing PGTA testing for our patients. We can provide, as I mentioned, PGTM if needed, if patients are carriers, and for sure everything is under individual support, individual service. We have coordinators of our programs. Doctor is responsible for sure, but patient knows, unfortunately not always doctor is available. So we have a team who will coordinate and help to communicate with the patient, to communicate patient with the doctor, and to choose the proper way and to make it easier. For sure, they may be even sometimes more available than doctor are, so full support, full coverage. And also, I suppose if we are talking about our advantages, we are clinic, we include not only fertility treatment, we have different doctors of different specialties, and if we are talking about obstetrician gynecologist, we have prenatal care unit here, and if woman got pregnant, unfortunately, not 100% of women got pregnant, but our success rate is quite high. Yeah. So they can stay with Medicover until the delivery. They can be under the supervision of our doctors, and if needed, in contact with the fertility doctor through all the pregnancy. Because in some cases, we will, actually, in majority of cases, we will need some additional treatment, like fertility treatment, but later we will need to stay with some medications, especially until 12 weeks of pregnancy.
I assume there is a philosophy. So what philosophy underpins the treatment you offer to your patients?
To help every patient who wants to make their dream come true. Actually, our patients, if we are talking about fertility, so their dream or their aim is to have a child, to have a healthy child. So we are doing all the best for our patient to choose the proper way of the treatment, which will give us the best result, which is a healthy baby, as soon as we can. Not staying with them for a long time, but we will help them to choose individualized plan, to choose the best way of treatment. We will discuss everything with them, so many times they will need to choose, once again, to choose the best way, to have the best result in the shortest way, shortest period of time. So.
That's perfect. And the most frequently asked questions, the success rate. So what was the success rate of your programs at Medicover?
Actually, it's quite difficult to answer it because, you know, when we are calculating success rate, it depends on many reasons, because we can make a kind of subdivision. Because if we are talking about for success rate in the regular patients, we will divide them into couples under 35 years of old and more than 35 years of old. And for sure the difference will be higher. But I would say that we have average 55% of success rate, taking into account all our programs. But if we are talking, for example, about egg donation programs, so here we will talk about 65% clinical pregnancy rate. And if we will move forward and we will calculate what we have among surrogacy programs, so it will be much more higher, so it will be from 80 to 85%. So, but for sure it will depend if we have own eggs, if we have donor eggs, if woman is a carrier or we have gestational carrier. So it depends, and it's always discussed with the patient individually.
As we all know, most of our patients are interested in egg donation, and you have mentioned about the egg bank. Can you tell us a little bit more to have more discrete information?
As I mentioned, we have our own egg bank, and its name is Ovoria. Ovoria works under the Medicover brand, but it is a separate branch, and we have possibility to choose the best donors from the bank, from our catalogs, which are available. We have more than 7,500 donor eggs available on the catalogs. Also, we have donors who are active donors, so-called active donors, so they can start into the program.
Cycle.
Yes, they can start into the program to take part in the fresh cycle. And fresh cycle, actually, what is the difference? In fresh cycles, just after the egg retrieval, we use egg for fertilization. So we will need the sperm be prepared for fertilization on the time of donor egg retrieval procedure. So also it is under the discussion what kind of treatment patient will choose, because some patients are able to come, some patients are able to transfer sperm sample for having fertilization. I didn't mention actually, I mentioned fresh and frozen, and success rate here is also very important when we perform warming. We don't know what is a success rate when we have cryopreserved oocytes, and when we perform warming we have quite high survival rate, so it's approximately 90% of frozen eggs which will survive after we will perform warming. And also success rate comparing vitrified oocytes and fresh oocytes are quite high, and we do not have a big difference between them.
So thank you so much for shared information. I'm sure it will be very useful for our patients, and it's as always my big pleasure to having you and discuss all this important matters.
Thank you, Anastasia, for coming. Thank you for letting us to share the information about Medicover, and we will be very glad to welcome you back here with your patients. Actually, we are very glad to welcome our future patients here, and we will do all the best to choose a proper plan and to reach the goal you have to have a healthy child, and we're sure everybody will reach it.
So, Julian, thank you for having us today in the heart of the IVF clinic in the embryology department. So, can you share with us what makes the Medicover lab special?
Actually, it's an interesting question. First of all, I would like to mention that we were one of the first IVF clinics in Ukraine, and the first clinic in Lviv for sure. And also we are a part of Medicover International Group, and it allows us to exchange knowledge, to improve ourselves continuously. I would say that all this many years of experience of working with the international patient, we also have international collaborations. They all allowed us to understand patient needs and hear them, listen to them carefully, and also offer a comprehensive solution to their problems. That's what I really think is important on the market.
What cutting-edge technologies are applied in your lab?
As you may see, we use a lot of incubators with really precise environmental control, different ICSI stations. Also, we use different techniques for in vitro fertilization, like common ICSI, PICSI, IMSI, whatever, vitrification, different type of vitrification, even the latest one, warm tissue cryopreservation. But I do believe that what really makes us stronger is that we accumulate all this knowledge and we build tailored approach to the patient treatment.
So, the patient have the biggest fear about everything that happened in the lab. So how do you make sure that all procedures are made safely and the highest quality is still in the priority?
Yeah, my friends always asking me about it. We use the gold standard. It calls double witnessing procedure. How it works? Yeah, so each process, each transfer of the biomaterial from one plate to another, from one probe to another, and vice versa, is followed and witnessed by two embryologists, one operator and one witness. It's simple, but actually it works. It helps us to prevent some biological material mix-up, and of course it is all marked. Yeah, like name, surname, clinical ID, date of birth, date of vitrification, what kind of biomaterial was vitrified. It is all recorded with the signatures, many other steps. Also, we put a lot of efforts actually on our quality management system. I would even say that like around half of my time, of my working time here, we strictly follow the instructions. We developed ourselves, we control ourselves, we have our internal audits. I already mentioned that we have some international collaboration. So, and of course we have international audits annually. We are experienced in working with the, for example, UK patient, and their HFA authority is really demanding, right? It's a continuous work of following everything, monitoring everything, right?
And what the advice you could give to the patients to increase their chances for pregnancy?
First of all, really trust your embryologist and medical doctor. But on a serious note, really following the strict recommendations of your medical doctor or embryologist, the right treatment protocol, as I already mentioned, individual approach that we apply, healthy lifestyle, and stress management, it actually what pays off. I would like to mention that it's a teamwork. So we will do our best, but we expect the same from our patient, because your success is our success, and of
Absolutely.
course, yes. As I already mentioned, it pays off, and our statistics shows that it works.
And can you share what the success rate your embryology department have within the IVF treatment, egg donation, and surrogacy?
Cumulative rate is around 54%, 65% on donation programs, and using surrogacy it's above 80%, and also we use PGT techniques.
What the cases where you recommend to do PGD, PGDA?
There are some recommendations. But in general, I would say that if you are a woman above 35 years old, or you unfortunately experienced multiple miscarriages or unsuccessful IVF treatment cycles, or of course, if you are acknowledged regarding the genetic heritage disorders, maybe PGT would be a good solution for you. Yes, but all this stuff they should be discussed individually.
And the last but not the least, how long the embryos can safely be stored in the lab fridge, and then the embryo or whatever genetic material can be later on used?
First of all, they are stored in the liquid nitrogen. It's worth to mention. Speaking from the biological point of view, they could be stored for years, even decades. And our experience shows worldwide experience shows that there is the success rate of a long-term cryopreserved biomaterial, oocytes or embryos, doesn't decrease. It's time for them stops. But from the legal standpoint, yes, there are some countries that they are implementing some time limits, but in Ukraine there is no such limitations.
Thank you. It's our pleasure.
Thank you.
It was my big pleasure to host you on this little tour to get to know the doctors and embryologists of Medicover Ukraine. I hope you liked the video, and in case you have any questions about your treatment in this facility, please contact Herman family for more information. Thank you.